The big question many people, including parents, have been asking this time is what effect the Omicron variant has on children. Worries, of course, have increased in the national capital after it was reported that 3 children who were COVID positive also died. But doctors have clarified that their COVID positivity was incidental. They were already hospitalised for other serious conditions. Meanwhile, a 1-month-old baby has successfully battled COVID and returned home from Delhi's Mulchand Hospital.
The highly transmissible Omicron variant is reaching children too. At the Delhi government's Chacha Nehru Children's Hospital, there are 14 children in the COVID ward. 3 COVID-positive children have died here in the past week. The medical superintendent says that although they are counted as COVID deaths, none were admitted because of COVID symptoms, but other severe diseases like heart failure, anemia and blood disorders. Their COVID positive test was incidental, says the doctor, and that there is no cause for panic.
मेरा ये मानना है कि पेरेंट्स को इस चीज़ से डरना नहीं चाहिए कि बच्चों में कोविड बहुत सीवियर हो रहा है, बहुत डेथ्स हो रही है, लेकिन उन्हें स्पेशली उन पेरेंट्स को अपने बच्चों का बहुत ध्यान रखना है जिनमें कोविड के उनकी एसोसिएटेड कोमॉर्बिडिटीज ऑलरेडी हैं. जैसे मान लीजिए कोई बच्चे को डायबिटीज़ है, या कोई बच्चे को ओबेसिटी है, या कोई बच्चे को हार्ट में कोई प्रॉब्लम है, किडनी में कोई प्रॉब्लम है. कोविड नॉर्मल बच्चों में, नॉर्मल हेल्दी बच्चों में इतना प्रॉब्लमेटिक नहीं है. जो आप अभी बोल रहे हो कि 3 डेथ्स है, वो 3 डेथ्स इसलिए कि वो ऑलरेडी बच्चे बहुत सीवियरली सिक बेबीज थे.
Recently, the Health Ministry shared some data that out of 97 deaths that occurred in the national capital in the span of 4 days, 7 were of children, creating panic that the new Omicron variant was leading to more severe disease amongst children. But Delhi's doctors say that the vast majority of these children had severe comorbidities and they didn't actually present with COVID symptoms. And across the country, doctors are saying that the Omicron variant is not yet leading to severe disease amongst children. Symptoms are mild and most can be treated at home. Abdominal pain and vomiting seem to be new COVID symptoms in kids.
Typical symptoms which are coming up are fever and scratchiness in throat, some running nose, or sometimes it's just a dry cough. And of course there are children who are also coming up with abdominal symptoms like vomiting.
A 1-month-old baby admitted to Mulchand Hospital for an ear infection also tested positive for COVID.
On examination we could find that the baby was very irritable. COVID in small babies, they can present with fever, irritability, decreased feeding. So it can be incidental, but it can be COVID ka presentation. There is absolutely no need to panic. See, COVID is again a viral infection which we in this way we are seeing that we need only symptomatic treatment.
Much to the parents' relief, the baby has now been discharged and is healthy. With Pavan Kumar, Meher Pandey for NDTV.